You guys, thanks for choosing this webinar. I'm Dr. E. Teraldi, and I'm going to give you a whirlwind, 100-mile-an-hour reason on why you got to worry about that waistline and how it reflects towards someone's metabolic health. What is metabolic health? We're going to define it shortly. It's something you don't want to miss. Give me a second. I'm going to share the screen, and we're going to rock and roll. Why we need to worry about the waistline, the metabolic health management plan. What is metabolic health? Without medications, it's having an ideal waistline, blood pressure that's ideal, blood glucose that's ideal, triglycerides and HDL that's ideal. And why is this important? Because if you are metabolically unhealthy, then you have the risk of the number one killer of the American species. You have a risk of obesity, you have a risk of diabetes, heart attack, which is the number one risk, cardiovascular disease, stroke, hypertension, high cholesterol, viral infections, as well as a familial disruptor emotionally and financially. Here's a schematic. Recently, 88% of Americans are metabolically unhealthy, and over 40% are obese, 9% of which are severely obese. And the CDC has recently sent out some amazing statistics that if you add overweight and obesity combined, over 70% of the US population is either overweight, or obese. Here's the consequences. Case one, look at the waist, 38 inches, 31-year-old, massive heart attack. Look at the LAD, gone. No metabolic health management plan. Next case, look at the waist. Case number two, waist, 37 inches, 42-year-old man, cardiac arrest, died 15 times. LAD gone. Coronary artery, got it back. No health management plan. Notice the labs. Next case, another young person, 57-year-old, look at the waist, 30 inches, only weighs 140 pounds. Look at the multivessel disease. Look at the labs. No metabolic health management plan. Case number four, again, a young nurse, look at the waist, 35 inches, already has coronary disease, no metabolic health plan. All labs are normal. There's another case, driving home the point, 54-year-old nurse, no calcium, but saw soft plaque on CAT scan. Look at the waist, 27 inches for how thin she is, no metabolic health plan. Here is, look at her lipids. Here's the next slide. She has a 70 to 80% soft plaque in the proximal LAD, coronary artery. I stented it. No metabolic health plan. I have one more case. These are all my patients. Case number 6, young man. Look at his waist, 34 inches. Look at his other labs. Pilot, calcium score, 2.5, abnormal, started on medicines, no metabolic health plan. This gentleman, we put on a metabolic health plan, primary plant-based. Look at his calcium score, 0. Look at his waist, 30 inches, off medicines. So why should you worry about that waistline? Increased risk of cardiovascular disease and type 2 diabetes. Look at the carnage. Remember, 88% of Americans are metabolically unhealthy. Why do we choose the waist circumference? Because it correlates with total body fat and visceral fat. It's easy to acquire. Here's an MRI showing what visceral fat looks like. And look at the yellow, that's the waist. Why do I want to check the waistline? Because it correlates independently with the BMI to predict morbidity and death per the National Review of Endocrinology this year. We should use it as a vital sign. It's simple, non-invasive. Why? You think you're not at risk? Well, the number one cause of death globally is cardiovascular disease. And if we can institute appropriate preventative measures, we can prevent premature death. Is this you, a high-stress entrepreneur, professional, lawyer? This program is for you then if you're a high-stress individual or entrepreneur with that expanding waistline and you want to permanently get rid of it to improve your metabolic health, and you're willing to work hard and you will invest in yourself, and family is important to you. So you can get lean and mean and get to work productively. You can get with your friends, you can run, you can get back into the daily activities of living. And we all know what the real problem is here. It's too much energy consumed and results in insulin resistance and free fatty acid spillover. Here's the schematic. It's complicated. You get dysfunctional adipose tissue, insulin resistance, you get lipid deposition. But the good news is I figured out a very simple program to knock this out, and we'll walk you through the training. The whole goal is to decrease your cardiovascular risk by getting rid of that waistline so you can spend time with the family, spend time in your life, enjoy work. Keys to your success is first you have to assess, you have to measure that waistline. The next thing to your success is we act and we implement a program called NEST, N-E-S-T, nutrition, exercise, get moving, sleep hygiene, and T for tackling stress. And then our third piece to success, our third pillar is live. Get those relationships together with your family, get outside, get moving, start to exhibit peace and love. With this, within weeks, you'll be proud of who you are and what you see in the mirror and how you feel. With this, you'll be one step closer to optimal medical health. With this, you will have delayed or maybe eliminate your risk for heart disease, the #1 killer of Americans. And the best part is you don't have to kill yourself in the gym. Even if you try different approaches, this is evidence-based. In my program, you'll have accountability and support at every opportunity from a team. And the only reason why I can share this with you is because I've gone through this with patients, family, and friends. I'm Dr. Iturralde, also known as Dr. Y. I'm an expert in metabolic health and ischemic heart disease. I'm also a research clinician. Just published this paper about epicardial fat. This is me. I'm with family. I exercise. I work. But I feel good because I follow my own strategies. And here's some testimonials over the years. They're all 5 stars. I'm not going to show you anything less. There always are. I'm human, but I'm going to show you the 5 stars. They're genuine. They're original. That's on Health Grades. You can look me up. Going through the program, the payoff, objective, decrease morbidity and mortality risk, get back on those beaches so you can do cartwheels. But hey, I'm human. I'm no superhero, but I can help you. Just imagine for a second, close your eyes, what life will look at if you feel your best, both inside and out. I can help you. You can enjoy life. You can smile at your job. You can celebrate your wins. You can go on vacation. You can come to Florida and see us if you're willing to sign up. We will help you. No question. So why worry about that waistline? Because it's about the metabolic health and reduce your risk for the #1 killer. 3 discoveries for a trimmed waistline and enhanced metabolic health. #1 is we all gain that 15 pounds. You don't have to. You do not have to follow this pattern. We can break it. The next discovery is skinny does not equal healthy. I showed you those body mass indexes and those weights in the waistline. And the 5 signs that you may be skinny fat, it's simple. Your pants are getting tighter. You have to let out a rung in your belt. And even the metabolically healthy, quote, metabolically healthy obese already has this metabolic signals. And #3, health is wealth. Put another way, wealth is health. As Ralph Waldo Emerson says, the first wealth is health. And this is true based on socioeconomic status as well. The higher income, the lower risk. So my proprietary blueprint, assess, act, live. Assess, measure, act, nest, live. Here's our pilot, #6. Look at his waist. Just remember, calcium score, 2.5, abnormal. Waist is high for his weight. No metabolic health plan. Other labs looked okay. He's on a metabolic health plan. Look at his waist, down 4 inches, calcium score 0, off medicines. Did the best thing he can for himself. The best way forward is to assess, act, then live. Live your life. I can help you. I'd love to help you, but you have to be willing to be helped. And there's one thing that I know for sure, you cannot do this alone. This is not easy. This is hard work. If you're not willing to put the hard work in, close the browser. Here's why. Research shows most people trying things on their own is futile. You need accountability. Most people become paralyzed with analysis. And what do successful people do? They find out what they want and they find out who can get them there. Not how, who can get them there. I can get you there. Here's exactly how I can help you. Exactly. I've set aside some slots in my calendar and I'll talk to you. I'll do a consultation free. Just like our previous case study of our pilot, I'll get you metabolically smart. And if you want to be physically and mentally strong with an energized life, I will find your blind spot. I will. I call it the metabolic health IQ call, and we'll customize a plan that you can stick with. And then it creates habit and self mastery. And we'll see if things make sense for us to work together while we're on the call. This is not for you if you're indecisive, not willing to work, and not willing to invest in yourself or your health. This is for you if you're decisive, you're willing to work hard, you understand the high value of health and will invest, and you want to enhance not only your personal and familial life, enhance your professional life, and you want to make a habit of self-discipline. Here's what you do. Click that link, schedule the call. I will do a free 30-minute consultation. And now you have two choices. This is your call to action, or this is your call to inaction, and keep doing what you're doing. And then you see what the consequences are. Schedule the call, hit the link. I really appreciate you going through this whirlwind tour. This is me and my kids. Thank you much. Peace and love.